Hi, welcome to Mad Medicine with Miss P. I only have a few minutes, so I'm just going to run through a couple that I got this week, and I've got to get going. I got to work tomorrow, and it is like 7 o'clock at night. I had a busy day, so I didn't get to prepare like I normally would. So just a couple little cute things before. I really wanted to read all of the student stuff, and I may be able to get into a little bit, but I got to get rolling here. So just a couple things from this week, some adorable things people say and some not so adorable. Some you kind of want to reach through the phone and slap them around a little bit, but you can't. So it is super important, obviously, before they have surgery that we get their complete medical history and ask them what medications they're taking, what surgery have they had in the past. Kind of gives us an idea of what organs are left, as well as do they tolerate general anesthetic and so on. So I talked to this sweet little lady who says, she gives me like, I had a hysterectomy, I had a breast reduction, and they always tell you, and I had 3 vaginal deliveries. You can do that at home. That's not surgery. Stop telling us that. That's not surgery. I don't know why my eye looks so weird because it doesn't in the mirror, but for some reason here it does. Maybe I need to blend better. That's not surgery. Stop talking about your vaginal deliveries. That's supposed to happen. That's not surgery. That is something that you can literally do at home. So stop telling us that. I don't even care if you had an episiotomy. Still not surgery. I mean, it's a repair, but you don't get anesthesia. Maybe a little local at the site. I don't know. Maybe they use ethanol spray. I don't know. At any rate, so this lady says, "Yeah, I think that's it. Yeah, I'm pretty sure that's all the surgery I had." Okay. Alrighty. And then the very next thing is, do you have a cardiologist? And have you ever been to a cardiologist for more than just testing or checkup? And never, never do they say no. They always say, yes, I have a cardiologist and and I go every year to get a checkup. Right, you're 72. I'm assuming that that's what happened. What I'm asking you is, other than a checkup or testing, do you have a problem where you have to see a cardiologist and kind of keep up with them because of an issue? Not just your common sense yearly physical, any more than I would ask, your PCP and do you get yearly physicals? I'm asking if you have any cardiac history. This is where she says, oh, yeah, that's right. I have a pacer and 5 stents. All right, so the hysterectomy you threw in there and your breast reduction, super important to remember, but completely forgot that you had a pacemaker and 5 stents. That's every vessel. I don't, unless there's an anomaly, you hit every vessel. I don't know how you don't see that as important. And they don't. It's just like it's totally, oh God, that's right. I have a pacemaker because the electrical current in my heart is messed up and it doesn't initiate correctly. Was that important? Should I have told you that sooner? So so then I'll say like, okay, well, what was the reason? Like I said last time, what was the reason you had a pacemaker? Oh, I don't know. There's something wrong with my heart. Well, that's true. At least you know that it wasn't in there prophylactically. But what was the problem? They never know. Then I get to the med list, or I go over the med list, or during the med list, I have an idea. And then sure enough, with this person, not only do they have CHF, they're in like chronic kidney disease stage 3, which of course he denied kidney problems. The 80 of Lasix kind of let me know that was a kidney issue. Also, what I notice is that I think nurses overhear, or patients overhear things that doctors and nurses say. So then they try to repeat them and they just sound crazy. Like, have you ever noticed that? Like, let's say your 8-year-old overhears you talk politics and then they're like, yeah, this guy's a jerk. And you're like, please don't do that. You don't know what you're talking about. I know clearly mom or dad must have said that. Doesn't mean they're not right. But please stop saying stuff that doesn't make any sense, because the things they say it's so painful. Or they'll say like keywords, but you can tell that they don't know what that means. This one lady said, yeah, I was in CHF, and I think it was a pacer lady. She it may have been, I can't remember. But she's like, I was in CHF, and they said I had about 4 beats left because all the fluid, because my heart wasn't pumping right. I don't even know what any of that means. All of the fluid, because your heart wasn't. So if your heart doesn't pump correctly, you start to produce fluid. We'll get into that next year. CHF, they produce more fluid. we'll talk about it. At any rate, I know what she was saying, and we'll get to it, but that's not. She doesn't know what she's talking about. And if I were to question her further, she would, start to backtrack and then, get defensive and mean. So obviously I don't even bother doing that. Then one of them said, like, I'll say, so I see Dr. So-and-so is going to do septoplasty with some, sinus surgery, concha bullosa. I try not to use those big words because I'll have that. I don't understand. I even like straight up told them, I told the foot doctor and I told the nose guy, the ENT, I'm like, you guys make up stuff. There's half the stuff I have to write on the consent. I don't even, no matter how many times they explain an out fracture to me, I still don't. That doesn't even seem like it should be something in your sinus cavity. I don't get it. I need to like see it to start to put two and two together, I guess. But I'm always telling them they're making stuff up. One of the doctors was like, you think I'm just inventing words? I'm like, yes, you are. There can't be that many bones in the foot that you're just making this stuff up. And there's always these doctor procedures, like the name of the procedure is the doctor's name, I guess, who invented it. He drives me insane. But one of these ladies, I said, so I see, you're doing this and this and this. And she goes, I guess. You guess? You have no idea what kind of surgery you're having? No, they don't. They don't know what kind of surgery. I'm not kidding. They literally don't know. Or they're like, yeah, my hip really hurts, so he's doing an injection in my hip. No, you're having an L5-S1 epidural steroid injection. It's nowhere near your hip, but the nerve that is innervating your hip is coming from that area. All right, well, whatever you say. That's a lot of trust in someone you don't know that's talking to you over the phone. But all right, I guess it's good that you're so trustworthy. I'm not sure. And if one more patient says like, I'll print out their information, and I'm like, 82 and never had surgery before and doesn't take any medication. It's not impossible. It's just a little unlikely. So I call them. I'm like, so I see that you've never had surgery before and you don't take any medication? Oh, no, I take tons of medication. It was just too much to put in there. Okay, well, then I'm going to do it now over the phone. I mean, you don't think it was maybe a little bit easier while you're sitting in the comfort of your own home with your bottles that maybe your wife can read off to you and you just type them in, or vice versa? Now you think it's more convenient for you to read the bottle, tell me, I type it in, I confirm it, then I ask you the next one, and then you look for the next bottle, and then you try to read it, and then you can't read it, and you go get your glasses, and then you make all kinds of moany and gross noises as you're readjusting yourself, and then giggling how you can't read it or you can't pronounce it, and then you have to spell it to me, and you can't see for squat, so you're spelling it wrong. And I'm sorry, is this more convenient? For whom? And then, one of them wrote down for the type of surgery they were having. I kid you not, I quoted it. Unknown at this time. I'm going to go ahead and I'm going to fill everything out. And when I get there, we'll just see what you're going to do. We'll just talk about it then. We'll see what kind of surgery I'm having at the time. We'll just check it out when I get there. I'll be fine. Whatever the doctor says, that's probably what I need. I don't know if I trust Jesus as much as these people trust their doctor. I should maybe work on that. And then here's another kicker that my coworker, whom I just love. She might be my girl crush. I just love her. She's so freaking funny. I'm like, hey, I noticed earlier you were on the phone. Did that patient stop their Nexium but continue to take their aspirin? Is that what's happening? And that's what's happening. They're like, well, the doctor told me to stop all my medications 5 days before surgery. No doctor told you that. They told you to stop their aspirin or your ibuprofen or your Celebrex or your diclofenac. Nobody told you to stop your metformin 5 days before surgery. Nobody's told you that. No one told you to stop your Lotrel 5 days before surgery. Nobody told you that. You may have completely misunderstood, which in turn tells me you have no idea what medications you're taking, what they do, or how important they are. But nobody told you to continue your aspirin but stop your Nexium. That's not, at some point, I just get concerned. And here's two other things I notice. I'm just, I have my long list of pet peeves here. If I say something like, when is the last time you had any aspirin, ibuprofen, Motrin, Advil, Aleve, vitamin E, alcohol, fish oil, BC powder, Celebrex, diclofenac, anything like that? When's the last time you had that? Oh, I don't take any of that, but I had some Tylenol yesterday. Okay, but what about all the other stuff? When is the last time you had any of that? Oh, shoot. I'm not sure. Okay, well, I'm gonna need to know. Can you give me like a month, a year, 6 days? Can you give me anything at all? Every time I ask them, I even say all of these medications specifically so I can give them examples of the things I'm talking about. And they every time tell me the last time they had Tylenol. I'm like, do you know why 4 out of 5 doctors say that you can take Tylenol? Because they want to cut you open. And if you've had aspirin, they can't. They have to wait. But they want to cut you open right now. So if you had Tylenol, say they can still do that. Why? Because it's not an anti-inflammatory. It doesn't have any properties affecting your platelets. And I can't get them to understand that. Or they've been on aspirin every single day for the last 40 years, but they won't take it the day of surgery. Yeah, that doesn't matter. You can take a handful of them that day. Now it's too late. All your platelets are affected now. That's not how this works. And I don't expect any of them to be a pharmacist, but like just a hair of common sense. Like I don't know anything, everything about my vehicle, even though I've been driving a car for, 30 years. I don't know everything about it, but I have an idea of how it works. I know not to put diesel fuel in it. I have an idea of how the rods and pistons work and what the layout of the motors for the most part. Only took one class, but paid attention a little bit because knowing that I'm going to drive a vehicle, I should probably know, how it works to an extent. And it's like nobody understands anything about the things they put in their body or how their body works. And I don't, I don't know why. It makes me sad. So that's that. All right, I got to get out of here, but I will just I'll give you maybe just one quick little tidbit of what's to come next. And I'm not sure where I'm going to start, but one of these is just cute. And these are way back when. Just some things that some of the students charted. I'm just going to give you like a little taste, and then maybe next week I'll dive deep. I should be able to do it next Tuesday. Lung sounds. Wheezy on the top. Wheezy on the top. Maybe George's on the bottom. Wheezy's on the top. Wheezy on the top. That's literally what it says. Lung sounds, wheezy on the top. Now again, I don't chart lung sounds because your lungs don't make any noise. It's the breath moving through those organs that make the noise. It's a breath sound. Lungs don't make noise, but that's okay. You can I'm not going to mark you off. It's just, I just want you to kind of think about that. Wheezy on the top. That doesn't tell me anything. Did you listen to any other lobe? What do the middle lobes area sound like? What do the bases sound like? It's just wheezy on the top. Inspiratory wheeze? I don't know. Expiratory wheeze? I don't know. That's almost as good as an inspirational wheeze. It's inspired by the wheezing. It's wheezy on the top. It's just a little tidbit. Got a long list of others we can get to. God, there's so much. I have like this entire folder filled with goodies. So we'll hit that next time. But I really got to. I got to get in the shower. I got to undo and get moving here. But that's just a little something to get started because. Sorry, I'm rushed. I have 100 other things to do. And of course, next week is New Year's Eve, so I should be able to get a video out on Tuesday. And I'll read through here and get a good list of fun stuff that's all my precious students say. I miss you guys. I miss my students. I miss the adorable things you say. I miss just saying a couple little things and then waiting. And then bing, I see the light above your head and you're like starting to put two and two together. And then you're so excited because you get it. Then like towards the end, now I see you getting angry, like at first you're scared and you're like, Miss Padalino, I have a question. And then like to the second one, you're like, so if I see this, then shouldn't this be happening? And then towards the end, you're like, okay, can I talk to you for a minute? Let me just tell you what I just saw. And then you're like all upset with the nurse or the patient or the doctor did this or something. And you're like, now that you know what's going on, you're all upset with things because you want the best for your patient. And I love that. And I miss that. So I hope you all are doing well and making fabulous nurses that I know you will. And next week, I'll give you some more goodies that your patients and your students and even doctors and nurses chart. I'm sure, charted some fabulous things. God, I wish I kept mine because I would absolutely read them to you. I would totally read them to you, no matter what I charted and how hilarious it was. I'd read it to you because I would like to watch it. and watch it back and let everybody else know that we are all human and it all starts funny. And then as soon as you start to know, what's really going on, it's less funny, maybe more sad, but we'll see. Okay, so as always, face your fears, forget your failures, follow your faith, and I will see you in a week or less than, hopefully, maybe.